tax-exempt bond financing to be issued through the Arlington County IDA. This would normally be on the consent agenda in a regular board meeting, but due to the proposed timing by VHC to issue by the end of August or early September, this is coming off cycle. And VHC greatly appreciates your ability to accommodate your schedule by having this meeting. As quick background, Virginia Hospital Center, Arlington Health System is a private not-for-profit Virginia corporation. They've been serving Arlington since 1944. Today, the hospital is an academic teaching hospital with currently licensed for 453 beds. They're affiliated with Georgetown University School of Medicine. They offer multiple centers of excellence, including bariatric surgery, cardiology, cardiovascular surgery, emergency medicine, neuroscience, oncology, orthopedic surgery, urology, and women and infant health. They're also accredited by the Joint Commission and licensed by the Commonwealth of Virginia Department of Health and a member of the Mayo Clinical Care Network. So this proposed financing, what they're proposing is involves the acquisition, construction, developing, and equipping of existing facilities to accommodate additional patient care beds, to renovate some patient care areas, including without limitation their emergency department, their obstetrics unit, their intensive care unit, their cardiac catheterization lab, some surgical suites, their pharmacy, as well as some observation units, their cancer center facilities, imaging facilities, and inpatient lab facilities, and also to repurpose some or all of the other existing facilities in connection with those projects that I just described above. And it also, part of the finance will include some of the closing costs and other typical costs related to a bond issuance. So the reason this comes to both the IDA and the county board, as under federal law and the Virginia Industrial Development and Revenue Bond Act, both the IDA and the county must approve the financing since it's within Arlington County, as well as there's a TEFRA here, in which TEFRA stands for the Tax Equity and Fiscal Responsibility Act of 1982. It's a public hearing that must be held prior to the issuance of bonds or approval of those bonds. That has been held by the IDA on August 1st, and there were no members of the public in attendance and no comments received. The IDA ultimately approved this item 5-0. So if this item is approved by the county board, there is no fiscal impact to the county or the IDA, and neither is providing any credit support to this project. The hospital is the borrower and will be solely responsible for paying debt service and any continuing disclosure requirements of the bonds. So with that concludes my remarks on this item, and I open up to any questions from the board.
Thank you, Mr. Freese. I do understand that we have representatives from Virginia Hospital Center who are also joining us remotely. You are not required to, but if you do, is there anything that you would like to add?
Hi, Chairman Dorsey, it's Adrian Stanton. As Jason said earlier, we do appreciate the board taking this, I guess the appropriate term is off cycle. As he described, you're probably wondering why are we going after these bonds? I would label it as the backfill project. So you're all familiar with the outpatient pavilion and the construction of that allowed us to move outpatient services over. It vacates a lot of space in the existing campus. And what we intend to do with that existing space is to correct some things that have been neglected for many years. Areas, because of their location and being, if you will, sandwiched on all sides, had no capacity to grow as the hospital grew. Those are, in addition to patient care beds, things like our inpatient pharmacy, which is right in the middle of the campus. Our obstetric services couldn't expand due to being surrounded by other services. So again, as those move over to the outpatient pavilion, it frees up space and allows us to correct some things that we've neglected for many years. And I'll take any other questions you may have.
Thank you. And the discussion is now with the county board because there are no speakers on this item. I will start by putting a motion on the table, and that is to adopt the county manager's recommendation, which is to approve the attached resolution of the Industrial Development Authority of Arlington County, Virginia, providing initial approval of the issuance of up to $150 million of revenue bonds for the benefit of Virginia Hospital Center Arlington Health System. Is there a second? Seconded by Vice Chair Garvey. That can now have discussion. Mr. DeFerranti, you want to start us off?
Yes, just very quick, one question for Mr. Stanton. I noticed, and this is just slight preamble to say that it's extensive staff report, as with many finance items. I just want to confirm that there's still work ongoing to finish construction and address issues of stormwater, noise, and traffic in the neighborhood. I know that we're still some number of days in advance of traffic issues, and I want to acknowledge that this is distinct from the 94 pages, but I just want to confirm that there's still ongoing work to try and address those issues and do so within the site plan conditions, as well as trying to address, I think really it is stormwater, noise, and perhaps traffic are the three most salient issues. Is that fair? Have I described it accurately, Mr. Stanton?
That is absolutely fair, and think your description is perfect. You are correct. We are still working through some of the issues with the surrounding neighbors, and you appropriately put them in the buckets of noise, stormwater management, and traffic. I would have said there was a fourth, which was lighting, but I think we have addressed that, at least based on the interaction we had with the latest meeting with the community. The mediation we did on lighting, I think has resolved that issue. There are a couple areas that are still under construction, so the ability to do the full extent of our lighting dimming can't happen until that construction's done, but I think we're down to those three issues.
Thank you, Mr. Stanton. I didn't want to belabor it. I'm also mindful that for me, this decision is rooted in the financial piece that Mr. Freeze mentioned, but I do feel like it's relevant and worthwhile to at least surface that there is ongoing work on those detailed issues. Thank you.
Thank you. Mr. Karantonis, and then Vice Chair Garvey.
Thank you, Mr. Chair. And thank you, Mr. Freeze. I want to align and associate myself with the comments of Mr. DeFerranti on this. We are observing how the relationship between the hospital and the construction and the neighborhood is evolving. We really share the interest of the community to come to a conclusion and to finalize that and to be in quieter and calmer and more neighborly waters. I have a question for Mr. Freeze. Mr. Freeze, I understand that this is a bond that is issued through the Arlington IDA. Does this change or influence at any rate our bond rating with our rating agencies, etc.?
No, it does not. So when this is issued, this is a conduit financing. It's fully backed by Virginia Hospital Center and their revenues. Neither the county nor the IDA is putting any type of credit support or any moral obligation or any other type of appropriation behind this. So it's merely a method that under the IDA, the rules to issue tax-exempt bonds, they must come through the IDA and use the IDA as the issuer, but the borrower, which is Virginia Hospital Center, will be fully responsible for all of that debt service, and none of it will revert back to the county or the IDA.
Thank you.
And so to follow up on that briefly before moving to Vice Chair Garvey, in the event that the IDA, for example, for whatever reason denied this request, would Virginia Hospital Center have any other options to pursue tax-exempt bond financing?
They would. There is also another entity. So there are limited entities within the state of Virginia that could permit the issuance of revenue bonds. The Virginia Small Business Finance Authority is also a entity that they could go through to issue these bonds. So if this was unsuccessful here, I believe they'd still have the opportunity to move forward there, depending on the timing. I know they're looking to move forward as soon as possible, so that could impact that timing there, should they have to pivot and go that route.
So in this way, the county through the IDA actually benefits, like to make a rough analogy, as a loan servicer, and will receive proceeds from guiding this transaction, but be under no obligation to fulfill its terms.
Correct. There is an issuance fee, application issuance fee, as well as an annual fee on these that that the IDA will receive as part of facilitating the transaction.
Thank you. Vice Chair Garvey.
Yeah, thank you. I'm going to pile on a little bit on the issue with the neighborhood while we've got a chance. And Mr. Stanton, it's nice to see you again. And I know you have limited control over how this all works out, but you know, I'm pleased to hear that you think you've got the lighting kind of solved. I continue to hear from people who've lived in that neighborhood for generations that it's still not going great. And of course, the history goes way, way back. So there's a lot of baggage back to the very beginning of the hospital. So I'm just going to say, I really encourage you to come up with some ways to maybe reach out to the neighborhood. I think from what I understand, even the ribbon cutting didn't go well for them. So anyway, anything that you can do or encourage, it's, you know, Virginia Hospital Center is such a wonderful resource for the community. It's an important part of our community. And this kind of constant difficulty and issues is really kind of painful to me and to all of us. And so anything you can do, maybe something a little different, I'm not sure what it is, but do a little thinking about trying to be more welcoming and make the community feel like they're more included in your decisions and thought of and considered and respected. Respect was one of the words that I continue to hear. So again, I know you personally don't have as much to do with it as you might, but I really do encourage you to take the message back and see what you can do, because it would really be nice to try to, with this all beautiful new building, new services, to really start off on a good foot and make a change about the history we've had for the last 75 or so years. Thank you. Appreciate it.
Thank you. Ms. Talento.
Thank you, Chair Dorsey. I just really want to echo my colleagues' comments on collaborating with the neighborhood. I do truly believe that having a hospital in your community is an asset and a valuable asset at that. And I know that Virginia Hospital Center has served our community in so many ways and does continue to find ways to support our community. I appreciate that. But Arlington is small, and I just want to reemphasize that working with your neighbors and being a good neighbor is important. And I have heard advocacy outside of this role about the concerns there. There's advocacy to put conditions on, you know, this funding. But at the end of the day, that's not going to change what you do if you have access to funding elsewhere. I think what's really important is just to emphasize that as you serve the community, also look at serving the community in the neighborhood that you live in. And what can you do to make that right or improve upon the impact to the surrounding neighborhood? And I agree, considering the history of where the hospital is and the neighborhood in which it lives in and how it served and did not serve in the past, and kind of bringing that as a whole today and finding a way to make that right. I'm not going to oppose this funding, but I do want to take this opportunity to just reemphasize it would be significant in our partnership for you to be a good neighbor to our community who looks at us to represent them at this table. That's all I have for today. Thank you.
Thank you. And on to the community piece, since it seems that we have no more conversations about the actual issue that's the subject of this hearing. I do want to acknowledge that we did receive less than an hour ago a letter from one of the neighboring civic associations, the John M. Langston Civic Association, that contained a number of concerns as well as a request, which I'll make sure gets forwarded to the hospital center. Not necessarily something that we could or should condition as part of this action, but I think one of the salient takeaways, at least for me, Mr. Stanton, is regardless of any efforts that VHC has made to be a good neighbor, they have not been as well received as I would hope you would like. And it's certainly an uncomfortable position to be considering changes for a community institution that I think you've heard from all of us that we all value, that nonetheless is causing great pain for people who are near neighbors, who are not necessarily looking at you as a hospital, but as a big entity within the neighborhood space that they occupy. So one of the things that I would encourage you to think about, not just how you can be better, but how to actually include those residents so that ultimately we can transition the relationship from they're viewing the hospital as a burden, but really as an overall benefit. The creation of a neighborhood council, for example. I know that you have community advisors who you bring together who speak to various constituencies that exist within Arlington that are helpful in promoting the general health and wellness of our community. Perhaps you could also consider some sort of a body that meets regularly that truly is a neighborhood council of the people who live next to and around the institution, who can become not only aware of what you're doing so that they can convey that to the people who they're close to in their communities, but hopefully also to create a better cadre of champions for VHC and what you do. And I think that's actually going to be very important as you consider what's going to happen with these with these bond proceeds. As I understand it, you're going to use it to sort of do a lot of work on the main campus itself, work that's not going to require a site plan entitlement where the government's going to impose conditions, but instead it's going to be sort of interior work, which I hope doesn't have a big neighborhood impact, but let's get ahead of it. Because if it's going to be construction work, for example, that may impact neighbors, let's make sure that they're included in a very robust way of understanding exactly what's going to happen so that we are not left again with people being unsatisfied with this hospital growing to provide the services that a modern, excellent hospital needs. So I know that that's a lot of words not about the subject at hand, but we will very much follow up to see how you receive the input that we're giving you today and make sure that we also follow up to share with you some of the communication that we've received related to this item.
And on behalf of the hospital, I appreciate not only the comments, but also the suggestions. And I will take this back to not only our executive team, but our board. And again, thank you for sharing those comments and suggestions.
Okay. Seeing no other microphones lighted, let's move to a vote on the motion. All those in favor, please say aye. Aye. Any opposed? The ayes have it, 5-0. Ms. Jacobs, will you now, thank you, Mr. Freeze, and thank you, Mr. Stanton. We're now ready to move to our next item.
There's a resolution of the Arlington County Board to partner with VA 250 in commemorating America's semi-quincentennial.
Thank you very much, Ms. Jacobs, for this one. This will be very brief. This has been shared with all colleagues, and Ms. Jacobs, I don't know if you have the ability to project it on the screen for those who may be watching remotely. But to frame it up, coming up in 2026, leading up to and around July 4th, America will be celebrating its semi-quincentennial, a fancy 50-cent word for saying our 250th anniversary. So this is not something that comes along every day, and therefore there's an effort that is being stood up, not only at the state level, but at the national level to commemorate it. So there is this umbrella national organization which is guiding some programming related to the 250th anniversary, and Virginia is one of the states that is very much leaning into this. They've also offered to partner with localities who are interested in doing any programming, engagement, or activations around the 250th, and as a way of getting access to their resources, funding in order to do it, a locality needs to consider a resolution that formally expresses a wish to partner, and that's what this is. And so I will not read it all, but generally it discusses the semi-quincentennial as it relates to an opportunity to promote Arlington's economic development and tourism, but also as a way to support an inclusive understanding of our country's history. And it tells you a little bit of what I said before about the state organization of Virginia 250, which has been established to support and partner with localities in commemorating this milestone event. And therefore, it calls on the county board to express its willingness to partner with VA 250, and it also establishes the Arlington Historical Society, which has accepted the call to be the convener of the planning and all activities to commemorate this period. And as an impact on our local government, we would have staff participate as they desired and as they had capacity to fulfill that work. But it's really not necessarily a government thing, it's a community thing. And one of the things that I see as a benefit of the 250th, it's to really tell America's stories in ways that we really haven't in the preceding 250 years, to be inclusive and recognize not only the folks who were in power to tell stories 250 years ago, but subsequently all those who are a part of the American dream and experience, who have flourished or who have persevered over the subsequent 250 years, to have their stories reflected in whatever we do locally. So that's that. I move adoption of this resolution. Is there a second?
Second.
Seconded by Vice Chair Garvey. Discussion. Anyone? See Ms. Garvey trying to get the microphone.
Trying to turn
Okay,
my mic
go
on.
for it.
Just thank yous. I mean, I'm so glad the Historical Society is willing to take this on, and that the state is providing some support. And I just find myself thinking more and more about the land we just purchased from VDOT, the bottom, which had indigenous people living on it. It had Black Americans living there before the end of slavery. A thriving community. Our Constitution, our Bill of Rights, and our Declaration of Independence apparently were sheltered there during the War of 1812. It really, went through the 20s, a thriving Black community that was, again, sort of destroyed by the government, which is what happened a lot in the 20s and 30s. And now it's a bit of a jungle, and I think needs to be really is an amazing part of the story and encapsulates American history in many ways in a very small bit of geography here in Arlington. And I'm hoping that perhaps that can be kind of pulled in and we can continue to do more with that, which I think can be a great resource for telling the story of our country. And I'm glad to just kind of give it a shout out here because I'm excited about it. Thanks.
Thank you. Thank you. Mr. Carantonis.
In a very similar manner, also aligning and associating myself with the spirit and the intentions of the resolution. Thank you for bringing that to us today to start this journey. This is a very big opportunity that we should use to convene our entire community and to celebrate everybody who has been part of the American experiment for these 250 years, and who will actually be defining the next 250 years and more. I look forward to connect and be in touch with the Historical Society to see how exactly this convention will look, and really think that it is an amazing opportunity to get all Arlingtonians, the entirety of our community, our entire diversity, our many stakeholders here, organizations and individuals from all walks of life, from all races, from all ethnic backgrounds, to participate in this commemoration in 2 years' time from now. Arlington has a lot to celebrate in that, and I agree with Ms. Garvey on that. We can literally show how these 250 years have created a community that should be exemplary in its way to celebrate 2026. Thank you.
Thank you so much. And I should also note and thank Delegate Patrick Hope for bringing this opportunity to our attention to sort of tag team with the state effort here and to allow Arlington to do a commemoration that also includes some of the resources that are provided through the State Commission. So with that, move to a vote. All those in favor, please say aye.
Aye.
Any opposed? The ayes have it 5-0, and the resolution is hereby adopted. At this point in time, I'd like to move that the County Board convene a closed meeting as authorized by Virginia Code Section 2.2-3711, A5, and A8 for discussions regarding a prospective business or industry or the expansion of an existing business or industry where no previous announcement has been made of the businesses or industry's interest in locating or expanding its facilities in the community, and also consultation with our county attorney regarding individuals eligible for legal representation and certain proposed ordinance amendments. Is there a second?
Second.
Seconded by Mr. Karantonis. All those in favor, please say aye.
Aye.
Aye. Any opposed? The ayes have it. The board is now in closed session. We thank those who visited us for this meeting this afternoon. I'm sorry that we didn't give you more of a meeting to watch, but we do appreciate your being here.
Thank you, Dave.